doctors. How is Johnny doing today? Is it right if I refer to him as Johnny?
Yeah, well, Johnny's doing okay. I mean, just a little worried. He's been having this little rash here on his neck, so.
Yeah, from what I've been told by this from the mother actually, and it's alright if I share it with my teammates what's been going on.
Mm-hmm.
So Johnny here, little Johnny here, he's a 10-month little boy, so cute, who presents to the hospital with this bump on his neck. His mother discovered it last night when she was washing the baby in the bath. It was a quarter in the size that she noticed last night, and then the next morning she noticed it was twice its size, and it was red on top of it, and when she touched it, the baby cried. Outside of that, she also noted that before she noticed this, for the last 2 days, the little Johnny had a cough and a runny nose, and also ended up spiking fevers up to 102 for the last night. And normally Johnny's a really, really good eater. She usually eats about 28 ounces of Momentum in a 24-hour period. But now he's not eating as well. He's been more fussy and refusing a bottle, though he's still passing stool with 5 of the 6 wet or dirty diapers. Now outside of that, he also notes that Johnny's brother has also been homesick with a fever and was being treated with strep throat by his pediatrician, Dr. Smith. And also that before, about last week, they went to the family, the mother came with the baby to the zoo because she was chaperoning her other son for a school trip that evening. But and they noted no trauma, no history of trauma to the baby in that area or any recent travel in the history. And review assistant, there's no drooling or difficulty breathing due to that mass being there, and there's also no pus or draining from that mass. And also there's just in the general assessment, there's no eye draining or ear pain. When MS to the head, she does know that the baby was feeling some kind of congestion, but no sort of fatigue or syncope. That's fainting. It's another word for fainting. There's like I said, there's a noted of cough and the redness of the neck, but other than that, there was no changes other than the general fussiness that the baby has. For past medical history, the baby had alerted. The baby had an episode where he was allergic to cow milk, though I didn't get exactly what happened when he was exposed to the cow milk. And then he also has a noted allergy to strawberries. And he has no surgical history, and currently he's been taking Tylenol every 6 hours, 1 dropper. And is up to date into his immunizations, other than he needs to take a PPD test. As for family history, his mother and father both have asthma, and he has a grandfather with non-Hodgkin's lymphoma, which was diagnosed at age 68. And just for social context, he lives with you and your wife and the brother and sister, and you both have 2 little German Shepherd puppies.
Mm-hmm.
Hopefully they don't go everywhere, or as them they go. And also a full-grown cat. And then if you're just looking at developmental stage for little Johnny, he's begun sitting up. He starts sitting up around 7 months. He's got a little pincer grip. He's crawling around in all fours. He's just going everywhere. And he pulls up the stand, but he doesn't say any words yet. And on the physical exam, the vitals for little Johnny, he has temperature of 38 degrees Celsius, a heart rate of 125, respiratory rate of 15, a blood pressure of 90 over 42. And on physical exam, the baby was crying. He wasn't very happy with that at the moment. He was sitting on mom's lap. Though in general, but other than that, he wasn't in other distress other than crying. And then the head in HENT, the head exam, he has his anterior fontanelles closed. He has his eyes were within normal limits. There's no scaling or alopecia on his head. Looking at his throat, there's no exudates or tonsillar enlargement and no erythema in the throat. We do know there's bilateral nasal drip, so he has a runny nose still. And there's two masses actually on the neck. There's the one mass that you notice on the left side of the neck, 3 by 3 centimeter mass with the oligoidea. It's not mobile and it is tender. And then there's another one on the other side, on the posterior right neck, that's 1 by 1 centimeter that isn't tender, and it's not noted whether it's mobile or not. I didn't know where it was mobile or not. Cardiovascular exam and respiratory exam within the normal limits. I didn't notice any coughing while I was there with me. And on the neural exam, he has full tone, he's alert, and symmetrical movement on both sides and continued deep tendon. And he has he has 2+ deep tendon reflexes, so that's nothing to worry about. And as for the skin, other than the noted erythema in the neck, he just has a mildly red area around the diaper area. In musculoskeletal scan, he has full motion in full range of motion in all his limbs and no edema anywhere. However, he does have inguinal lymph nodes in both the right axillary lesion and in both inguinal in both inguinal areas, like around the legs. Those are just the little masses like you can feel. And as for labs, we have a white blood count of 13, white blood cell count of 13, hemoglobin hematocrit of 13/37, and platelet count of 27, like 275, and then imaging. I don't know how many imaging, but we do have a picture of the rash. Now, as for him, we have a 10-month a male infant who's here because of a swelling in the neck, swelling and redness in the neck. It could be a variety of things, but one of the things we're thinking it could be like he has an infected salivary gland, like where the saliva is being produced. He may have gotten that from like a previous cold that he used cotton from his brother, or it could also be like swollen lymph nodes that have gotten like a massive inflammatory reaction in that area. So we'll just work that up and make sure everything's okay. Now, do you have any concerns for me that you're worried about specifically?
You know,